Hello and a very good afternoon to all our viewers who are joining me in this live interaction of News 9 on Facebook and YouTube page as well. So today we will be speaking about the challenges that India will have to endure even after vaccine is completely developed. And now if I have to give you a bit of the introduction of today's topic, even as we are trying to, hunt down COVID-19, the means to end this pandemic is currently on the horizon. But even as scientists around the world are busy in vaccine development, there are several challenges that the world's largest democracy will have to face. And if I have to speak to you more, well, about 4.3 million patients have recovered. Lockdowns imposed to contain the highly contagious disease have wrecked the Indian economy and triggered a wave of job losses and also mental health problems. There are problems which India is facing already. Only a vaccine can induce an immune response in order to put an end to this pandemic, and the levels of the antibodies must be high in order to prevent the cases of COVID-19 from rising and also to curb the spread. Now, when a safe, effective and also affordable vaccine is available, authorities will have to quicken its mass production and also make it market ready with all the regulatory concerns taken care of. And India is also the largest vaccine maker, supplying more than close to 60% of the stocks that the developing world gets. But the challenges in India once a vaccine is developed are myriad. Now, in order to answer a few questions surrounding this particular topic, we have with us Dr. Shailendra joining us live from Sydney. Many thanks for joining me in this live interaction, Dr. Shailendra. And my first question to you
pleasure, Deepak. It's a
today
pleasure to be
is,
with you.
Doctor, my first question to you is, how can inequality in providing vaccine be prevented once the vaccine is developed in India, Doctor?
Sorry, Deepak, you broke a little bit. Can you repeat the first part?
Sure, Doctor. How can inequality in providing vaccine be avoided or eradicated in India?
Inequality, is that what you're asking?
That's true.
So your question is about quality of vaccine.
No, inequality.
So look.
Inequality.
Oh, inequality.
Yeah.
Inequality of vaccines.
Right.
Okay, well, that is a very good question, Deepak. I think one of the challenges we are going to face with the COVID-19 vaccine, if and when it is available, is to be able to give it to those most at risk, which is at developing serious disease, and that's older people. Okay. But also most of those who are at the front line of services, including the health services, but also essential services. It's the other issue is about in terms of the access to vaccine, if it's going to cost something. Now, governments across the world, including India, are going to hopefully offer it free of cost to people. But free of cost vaccine is free to the end user. It's not free to the system. And that's really important, that if a rural India needs to get the vaccine, to be able to get the vaccine to rural India, there's going to be a lot of roadblocks for vaccination delivery. So that equality of vaccine delivery is going to be an important issue when you actually get an effective vaccine. Now, India is lucky in a way that a lot of vaccine will be produced in India because of vaccination companies that exist in India. They're not going to depend on shipping vaccine from overseas or flying it from overseas. Now, that is one part of the puzzle.
Okay.
The other component is getting that vaccine to the people who need it in various cities across the country, various rural places across the country. And that requires an extensive transport infrastructure, an extensive warehousing capacity at different levels, and the cold chain management. So those are important issues that one needs to look at.
Also, Doctor, now my second question to you is that India will also look at, distributing vaccines to some of the remote areas such as Ladakh and even the Northeast. So what is the importance of logistics here?
Hugely important, Deepak, because vaccine is unlike tablets or other medicines which do not typically require a temperature management. Now, there are a lot of unknowns in COVID-19 vaccines. We don't know at what temperature we need to store these vaccines. We don't know how many vials are going to come into each box. And what it means then is that, and how much time each temperature variation needs to be maintained. Most vaccines that we have currently, we're used to maintaining them at refrigeration temperature, 4 to 8 degrees centigrade. Now, there are some information coming out that we might need a much stronger cold chain management to transport these vaccines. And that's where it's going to be very tricky, especially in areas such as difficult to reach areas, hilly areas across the country. You're going to have challenges in maintaining the cold chain for that long length of time. So that is one of the big issues. The other issue is local storage, because what we underestimate, we are going to have to ship or transport through trucks and trains and flights extensive amount of vaccination. Now, we've never done that before in the scale that we're talking about, because the whole idea is to vaccinate people very, very quickly so that we reach the herd immunity levels that we expect it to be reached. Now, that means requiring hundreds of millions of vaccinations to be distributed across the country, including the difficult to reach areas. So that definitely is an issue that one needs to really carefully look at.
Also,
Cold
Doctor,
chain management, transport issues. Yeah.
Also, Doctor, now we have always read that vaccine trials are usually done with healthy individuals. But will vaccine be able to shield the elderly?
Right. So again, we hope that a number of studies that are currently ongoing are taking people at different age groups, and that might allow us to have a bit more confidence. Now, you might or might not know that obviously most vaccinations are given to children. Across the world, there are some adult vaccination like human papillomavirus vaccine, which is not routinely given as a national program in India. Varicella zoster vaccine, which is given to older people, or pneumonia vaccines, which are given to older people. Now, in India, we don't have too much experience of mass vaccination of young people or elderly people. So this is a complete unknown for us in a way, whether our vaccination delivery, which works very well for children, whether we can scale that up to include younger adults and indeed the elderly. So that is definitely another challenge.
Also, Doctor, now the major debate that is currently raging is on this particular question, which is who should get the vaccine first. So how is the decision made on who will get it first?
So every country, including India, is developing a vaccination implementation plan. Now, what that looks like typically is people who are most at risk need to be prioritized. People who are at frontline services, including obviously mainly the health services, but also other essential services like groceries. People need to buy groceries, and those people are at risk of meeting a lot of people. Municipality services, civic services, all those people who are at frontline, who are essential workers, they need to be vaccinated. Now, in India, obviously, that means significantly large number of people who need to be vaccinated and prioritized. What is challenging is basically then to look at where the impact is going to be maximum. We are working with our partners in India to develop some kind of guidance to the government organizations and institutions to say that these populations, if you implement vaccination in these populations, the impact is going to be maximum, because we're not going to have a vaccine and in 3 months' time everybody is going to get it. It's going to be a long, drawn-out process, because we are looking at millions of doses of vaccination. So it's not going to happen in 6 months. It might take almost 3 years for us to vaccinate all of them which need the vaccination. What we don't know as well is whether we need one vaccination is going to be enough, like we give it for measles, or we're going to need multiple vaccinations like we give for influenza, which we have to give every year. So those are big unknowns, and that's going to add huge cost and huge exercise. So that means if we have to vaccinate every person every year, that means we're going to need multiple doses and a pipeline of these doses to come across. But also then to make sure that all those who are frontline do receive the vaccination. So yes, there are challenges. Elderly people typically do not have a voice in most societies. They're difficult to reach. They may not be mobile. And so there are lots of challenges to get and reach them. Rural India is another challenge, obviously, because just to get there is a problem. Then to reach the older population in rural India is going to be a huge challenge for us.
Also, Doctor, my last question to you is, how is the situation in Australia compared to back in India, and what is your message to the people across the world?
Yeah. So look, in Australia, I think we've got it reasonably under control at this stage. We haven't had a new local transmission for the last few days in Sydney, where I live. Melbourne had some issues, but that is significantly under control now. Most of the regions across the country are working and they're open for business largely. The schools are open. So I have two kids who go to school, and they've been going to school for the last few weeks in spite of the challenges. So I think the situation in India is challenging at this stage with a significant number of new infections every day. But there are some good things. The mortality rate in India is quite low, which is a positive sign. The testing has increased. Having said that, the positivity rate still is quite high. I think testing needs to be expanded more because what we are going to gain insights into is to how to reach the population that needs testing. They to be the same population that will need vaccination as well. So what we learn from testing regimens is going to be very useful when we launch vaccination.
Right, doctor, what's your message to the people? Now that a vaccine is on the horizon, so till we see the light of the day, what do you think people should do?
I think one of the important things from government organizations, from institutions, is communication, communication, communication. Talk to people. People need to start listening to the government advice, and then when the time comes to get the vaccination, people need to get on board and get the vaccination. Sometimes there are a lot of voices saying, don't take it, it's not useful, it's risky. I think it is so important to trust the institutions and the government in when the vaccine is launched. Please go and get it. If you are at higher risk, make sure you get it earlier. And the key thing, I think, is listening to the communication. And from government organizations, the communication needs to be very clear and straightforward to people.
Right, Dr. Shailendra, many thanks for joining me in this live interaction. Well, that was Dr. Shailendra joining us from Sydney, and his advice was for people to listen to the government, and the directives issued by the government should be followed on a very strict basis. And until we see a vaccine, the only thing that will save us from COVID-19 is safety precautions. So make sure that you have a good hand hygiene and also wear your mask at all times and wear it at the right place. If you like this interaction, please drop in your comments and also like, share and subscribe to News 9 on various social media platforms. Thank you for watching.